Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. IBS, that is the inflammatory bowel disease, and you're looking at its diagnostic criteria. So, as per the ROB criteria, the IBS is defined as a recurrent abdominal pain. So, it's a recurrent abdominal pain, and this is seen at least 1 day per week. So, 1 day per week, and in the last 3 months. In the last 3 months, you have recurrent abdominal pain, which is 1 day every week, and it is in 3 months. So it must be associated with 2 or more of the following criteria. So 2 or greater than or equal to 2. So what are the criteria? That is related to defecation. So it is related to defecation. So under defecation, there can be improvement as well as worsening. So increase or decrease. Next one will be the associated with the change in stool frequency. So this change in the stool frequency. Next will be associated with the change in the stool form. So change in the stool form or appearance. So these criteria must be fulfilled for 3 months. So they are fulfilled for 3 months with the onset of some symptoms at least 6 months before the diagnosis. To learn and grow daily like this, please do subscribe.